Providing physical assistance to the person requiring your support may extend to their prepackaged medication. Where assistance is required, you should be fully aware of your scope of practice, organizational guidelines, and legislative and regulatory requirements in your state or territory. Physical assistance requirements should be set out in the medication care plan. The assistance provided by a support worker may include simple tasks where a person has cognitive knowledge and an understanding of their medication, but has physical difficulties with administering their medication. Depending on a person's medication care plan, examples where assistance may be provided include removing tablets from dose administration aids, like blister packs, bubble packs or sachets, unscrewing bottle lids, placing medication into a spoon or medication cup and then into the person's mouth, observing the person to ensure they do not experience difficulty in administering their medication, record their medication administration, and helping to store medication. Other than the administering of prepackaged medication, a support worker should not administer medications unless correct training is provided and organizational policies and procedures are being followed. Best practice requires that before a support worker undertakes a role in medications, they must successfully achieve competency in national, industry-endorsed competences. These competences may be accessed at training.gov.au. Before assisting a person with taking their medications, you should ensure that the tasks you are required to undertake are within the scope of your role. Prior to commencing, you should consult the person's medication care plan, which outlines specific assistance requirements. Before assisting with medication, you should ensure that you have correctly identified the person by checking their medication-related documentation, which for a person in residential support, both aged and disability, is known as a resident identification chart or Webster pack. Medication-related documentation should show the dates when the administration of medication commenced, and in some cases when it should be ceased. Identification details should include the person's name and preferred form of address, the person's date of birth, a current photograph with the person's name and date when taken, doctor and pharmacy details, any alerts, such as another person with the same name, and any allergies. Support workers should always be alert to circumstances when medications may not be administered. This could be when the person is feeling sick and suffering other symptoms of concern. This may be caused by the medication and may also include itchy skin, dry throat, drowsiness and vertigo. If not caused by the medication, these symptoms need to be considered in the context of the medication and its effectiveness. There is, therefore, a belief that the person may have had an adverse reaction to the medication that was previously administered. Another example is if side effects have been identified and information on the medication states not to proceed if these side effects occur and to see your medical practitioner. For instance, antidepressant medication may cause dizziness, drowsiness, irritability, depression, and, in extreme cases, suicidal feelings. When medication is out of date. For instance, liquid eye medications going past the expiry date may lead to bacteria and fungus growing, which can cause eye infections. Thyroid medications are also sensitive to expiration dates, as older medications may not be able to effectively stabilize thyroid-stimulating hormones. Where a prescription-only medication has not been prescribed or recommended by a medical practitioner. Where the medication is not contained in the original packaging, the dose administration aid or DAA packaging is damaged, or medication has been spilt on the floor. And lastly, where there is uncertainty about the prescriber's instructions. Support workers should always remember the 7 rights for safe medication administering. Right person. Check the person's photo identification and the name on the medication container to ensure they match. Right medication. Cross-check the medication name in the person's medication care plan with the medication label. Check that the medication has been correctly stored and has not expired. Right dosage. Check there is the correct number of capsules or tablets in the section that is to be used in the DAAs. For other packaged medication containers, ensure the dose is clearly documented on the pharmacist's label. Right time. Ensure medication is taken as close as possible to the prescribed time and follow other instructions by the dispensing pharmacist. For example, medication should be taken with food. Right route. Ensure the medication is taken or applied via the prescribed route, which should be provided in writing by a medical practitioner. Examples are oral, topical, and inhalation. Right to refuse. Remember that a person has the right to refuse medication, which must then be recorded in their medication record with contact then to be made with their medical practitioner. And right documentation. Ensure that the medication is signed by the staff member on the relevant form and that the correct code for specific circumstances is used. We hope this has helped with your unit of study, and thanks for watching.